YouTube. I am live on TikTok. Hello. Okay, so part five, reading the book by Dr. Neil Rozier. It's really just a brochure. He actually has a full length book, and I always recommend reading other books such as The New Menopause, um, Estrogen Matters, Rethinking Hypothyroidism. All of those are good audiobooks to look into to get yourself more informed about hormone replacement therapy. This is just a quick summary that Dr. Rosier wrote, and I'm reading it for people because you asked. You all asked. So this is part five. So I'm doing this little 20-minute videos, and the four already uploaded here on YouTube, IBI Healthcare Institute. You can go there, follow, click like, and obviously comment, and subscribe. That's what we do, right? So we already discussed in previous videos the chapters of the book. Obviously, introduction, we read that. What is hormones? What is bioidentical hormones or biologically identical hormones? What is hormone replacement therapy and aging? Thyroid hormone, estrogen hormone, progesterone, and now we're moving on to bleed or not to bleed. That's a very common question and conversation. Testosterone for men and then testosterone for women, and then a couple other things that left over. So we're gonna move on with to bleed or not to bleed for people who follow me on TikTok. We can stay afterwards and answer questions. For YouTube people, make comments on the YouTube channel so that way we can then, you know, have discussions. Okay, to bleed or not to bleed. The hot topic for celebrity shows and celebrity books is bioidentical hormones. The media has highlighted the term bioidentical hormones, thereby making it a familiar subject for both women and men, especially those coming to grips with the aging process. Now we can further define the term natural and specify bioidentical, which gives everyone a new understanding and appreciation for hormone replacement. Out of this media frenzy have emerged new experts with expert opinions on the right way to take hormones. One of these expert methodologies of hormone replacement, unfortunately, has made many women apprehensive. Some are so displeased that they avoid taking hormones altogether. Some experts theorize that cycling, creating a period every month, is recommended and natural. Not for me. The implication is that women menstruate while they are young and healthy. Therefore, in order to maintain that same healthy status, all menopausal women should continue to menstruate. Oh, hell no. Oh, no. The cycling is done by stopping progesterone for 1 week of each month and thereby creating a menstrual cycle. Most women find this recommendation unsatisfactory. I agree with them. If women believe that taking hormones requires that they have a period, most women choose to pass on hormone replacement. What is cycling? Yeah, please tell me. It is the fall of women's hormones that results in menstruation. Therefore, if a woman stops the progesterone for a few days every month, she will cycle and bleed. This is possible even if you have been years without a period, unless, of course, you had hysterectomy. Just because it is natural in younger women does not mean it is necessary or beneficial for menopausal women, because I'm for sure not trying to have a kid after 40. Just personal opinion. Or, have life. Anyways, menopausal women do not need to menstruate. This is like in bold letters in the book. Taking hormones does not necessitate cycling. First of all, hormone replacement therapy does not put one in state of pregnancy. During pregnancy, the levels of estrogen might be in the hundreds. On estrogen replacement, ideal estradiol levels are typically 60 to 100. I think more ideally is like 75 to 100, far from what we see in pregnancy. Secondary, the reason a woman menstruates is to clean the uterus in preparation for eventual implantation of fertilized egg If one is not interested in becoming pregnant, there is no physiologic reason or benefit of menstruation. A recent article in obstetric and gynecological literature claimed that unexpected vaginal bleeding was the most common reason women stopped taking HRT. The cessation of periods was one thing that women welcomed with menopause. The medical literature often addresses how to stop and prevent postmenopausal vaginal bleeding so that women will be comfortable in continuing hormone replacement therapy. Dr. Wuzier has always advocated increasing progesterone to prevent postmenopausal bleeding. With the appropriate balancing of estrogen and progesterone, women should not bleed and will be more satisfied with continuous use of HRT. Also, since estrogen and progesterone are so important, why take them for only 3 weeks per month and stop them to bleed in the fourth week? A woman would lose the protection and benefit of estrogen and progesterone if she did not take hormone for quarter 25% of the time. That makes no sense. For years, women have been treated with birth control pills, taken continuously and not cycled to control PMS. It is the fall of women's hormone that takes place right before the period that causes the symptoms of PMS. By taking birth control pills continuously, a woman can avoid this drop in hormones and the symptoms of PMS. The pharmaceutical industry has now caught on to this and promotes a new birth control pill that is cycled for bleeding only every 4 months instead of monthly. The researchers claim that while no menstruation is necessary, the cycling allows women to menstruate every 4 months to make them feel more normal. We now realize that even premenopausal women do not need to menstruate, let alone postmenopausal women. I definitely avoided that part of my physiology when I could, especially being a surgical resident or a surgeon. I literally did not have time to deal with this kind of stuff. So I actually made sure I cycled my birth control so I did not get a period while I was in residency. I literally would not get a day off if I got sick. So yeah, no time for that. Who has time for that? Remember, cycling involves stopping the hormones for a week each month. Another reason not to cycle is the loss of protection that takes place when the progesterone is not present. Bioidentical progesterone protects the breast and uterus against cancer. The bleeding that takes place with menstruation is not what protects the uterus against cancer. It is the direct effect of progesterone on the uterus that protects it. Stopping progesterone for a week means that the body is without the protective benefit of progesterone for those days. It makes no sense to lose this important protective benefit for 7 days every month, which is literally a quarter of your life, right? Recent studies have shown that Provera, which is medroxyprogesterone, increases the risk of breast cancer and increases the thickening of breast tissue. It does this by direct stimulation, upregulation of estrogen receptor site on the breast. One study showed that Provera increases breast stimulation by 400% over baseline. The same study showed that bioidentical progesterone, which is what we normally use as bioidentical, different from Provera, does not stimulate breast tissue as it down-regulates receptor sites in the breast. Therefore, why lose the protective effect of progesterone by stopping it 25% of the month, which means you lose 25% of the protection. So he just kind of repeats the same thing over and over again several times, I guess, to drive the point home. There is a condition known endometrial hyperplasia. This condition causes increased thickening of endometrial stripe uterine lining, which is a precursor for cancer. So if somebody is having too much bleeding or issues, they would get ultrasound of their uterus, which is transvaginal ultrasound, usually where they measure the thickness of endometrial lining, which is the lining of inside of your uterus. And if it's too thick, and let's say treat it with progesterone, it didn't get thinner. If it's too thick, we do biopsy, and biopsy can be very important in determining whether there is endometrial cancer. So endometrial hyperplasia is a known condition. This condition causes increased thickening, so I just said that. This condition must be treated to avoid the development of cancer. The treatment is high dose progesterone to shrink this tissue. Conventional physicians would use Provera, but remember, we prefer to use bioidentical hormones, and therefore we use regular progesterone, micronized progesterone. If repeat ultrasound does not show a decrease in endometrial lining, then the dose of progesterone is doubled. The shrinkage of the endometrial tissue is a result of direct stimulation by progesterone. The protection does not occur because of the shedding of the lining. A constant, sufficient dose of progesterone is the better protection against cancer. Therefore, progesterone should never be stopped for any reason. In summary, women on hormone replacement therapy do not need to cycle or stop progesterone and bleed on periodic basis. There is no there's no benefit to the body to regularly bleed. It's just pain in the butt. That's what it is. It's just painful. And it certainly makes hormone replacement therapy and its many protective benefits a more attractive and convenient regimen for women. All right, so that was a chapter to bleed or not to bleed. In summary, there is no reason to bleed unless you try to have a baby. Okay, testosterone for men is the next chapter. I've never felt better in my life. Thank God I found someone who knew how to prescribe this stuff. Patient Ernie O. So that's a quote from the patient. Testosterone has always been known as a male sex hormone. It has recently been shown to be linked to longer, healthier lives in both men and women. As testosterone levels decline with age, there are health problems that accompany this loss of hormone. Testosterone replacement has been shown to be effective in providing many health benefits. And by the way, you're all welcome to listen to this piano concert on the background. It's for your benefit. So the testosterone replenishment results in increased muscle strength and lean body mass, improved sexual response, reversal of impotence, and improved body composition. So you guys all know about body composition, what's more important, muscles more important, right? All that stuff. Testosterone has also been shown to prevent osteoporosis, arthritis, and degenerative joint change. It improves the sense of well-being and depressed mood that are frequently seen in andropause, which is a male menopause. Andropause, like androgen. It has also been shown to improve memory, as does estrogen in women. Most of all, it has been shown to protect against cardiovascular disease in both men and women. Men who receive testosterone replacement consequently report that they have or feel sexier, stronger, and healthier. They state that it makes them feel as they did when they were in their prime. After all, this is what replenishment of hormones is all about. It is about restoring hormones to youthful levels so you can feel as you did when you were at the peak of your physical and mental ability. Testosterone can slow down the physical decline that robs men of their energy, strength, and libido. Testosterone can restore muscle tone and improve stamina. Testosterone can restore healthy sexual excitement and desire, which in turn results in all improvement in mood and overall well-being. Testosterone is responsible for the sex drive of both men and women. As testosterone diminishes with age, so does the sexual functioning in both men and women. Restoring testosterone to youthful levels can reverse the situation. All too often, men and women automatically assume that as they age, their sexual capacity will diminish. Right? Normal, getting old, what do you expect? Right? That's what we normally get. There is no need to accept this loss of sexuality. Testosterone can play a critical role in helping to preserve and even restore sexual desire and function so that we can live our extended lifespan with the same excitement and enthusiasm we enjoyed in our youth. I'll take that. Physicians are witnessing an explosion of interest in testosterone as a result of our growing realization that testosterone levels decline with age and that many men suffer serious consequences to their physical and mental health as a result. In women, it is also expressed as menopause, whereas in men, it is expressed as andropause. Many of the symptoms and disease processes that we have come to accept as a result of normal aging are processes that are actually secondary to low testosterone levels and are easily correctable. Testosterone supplementation results in increased muscle strength, muscle size, increased energy level, decreased fat, and increased desire and endurance for exercise. As a result of this, the FDA recently approved the testosterone patch and topical gel. Now, both men and women may be treated for their sex hormone deficiencies. In the past, testosterone was not approved for use as a replacement hormone, right? So, not for average person, but now it is more available. Testosterone replacement in the past has been associated with increased cholesterol levels. I feel this is a properly secondary to the use of synthetic testosterone that resulted in liver dysfunction and the concomitant elevation of cholesterol. Studies now show that the replacement with natural testosterone, again, we're talking about bioidentical hormones, results in a decreased total cholesterol and increased HDL, which is a good cholesterol. The good cholesterol is similar to what has been realized in women taking estrogen. Now, many of the supplements that we take are not only beneficial to our health, but also result in increased energy, increased stamina, and elevated mood. What other supplement can build a strong body, strong muscles, strong bones, strong ligaments, and trim fat at the same time? An added benefit is an improvement in improved desire to exercise due to less exhaustion and lethargy. Clearly, testosterone is shown to have a positive impact on men's health and well-being, our mood, and our availability to learn and retain information. So it affects your brain, same as estrogen in women, where women get brain fog and just overall memory issues, right? Testosterone does the same thing for men. There is a good evidence that testosterone deficiency plays a role in heart disease. Despite many well-designed clinical research studies documenting a broad range of cardiovascular benefits from testosterone, it is virtually ignored by US cardiologists. Patients with the greatest arterial blockage have the lowest testosterone levels from one recent study in 2,500 men. So they looked at a whole bunch of men, 2,500, measured their atherosclerosis plaque. So the plaque in the arteries, the one that gives you strokes and heart attacks or blockages of your heart vessels that causes heart attacks. And the ones that had the lowest testosterone levels had the thickest plaque. There is a clear association, right? The study from UC San Diego not only showed that the men with higher baseline levels of testosterone had less cardiovascular disease, but supplementing to youthful levels prevented worsening of cardiovascular disease. In spite of this data available in the medical literature, physicians remain somewhat oblivious or resistant to the benefits of testosterone. Testosterone supplementation helps reduce obesity, raise lean body mass, normalize blood clotting, and raise the good HDL cholesterol, all of which decrease the incidence of diabetes and cardiovascular disease, some of the most common killers in the United States, right? It is also prevents cognitive decline and Alzheimer's disease even better than estrogen in women. A recent medical study showed testosterone reduced C-reactive protein, CPR levels, a measurement of inflammation in blood vessels. Testosterone protected against heart attacks and progression of heart disease. Yes, testosterone has been demonstrated to increase lifespan. A recent study from Annals of Internal Medicine demonstrated that men with the higher level of testosterone lived the longest. Men with lower levels of testosterone did not live as long. This makes one wonder why most physicians fail to recommend testosterone for all men. Testosterone can be administered in the form of injections and oral supplements. We prefer not to use either of these methods as the testosterone is in the synthetic form. Testosterone in synthetic form is metabolized in the liver, which raises cholesterol levels. A topical application of natural testosterone does not undergo the same metabolism and therefore reduces cholesterol levels. So it's not just knowing which testosterone to take, it's understanding why. Why would I choose a cream over the pill, over the shot, over whatever, right? Because there are reasons, as in metabolism location for that particular medication. Testosterone patches also available. We found these patches to be unacceptable secondary to the inability to get optimal blood levels. The uncomfortable feeling of the patch and unsightly tattoos that result from their use. So sometimes when people use the patches, they leave like marks, and that's what they call unsightly tattoos. And also the fact that you, with a patch, sometimes you cannot get to therapeutic level, the level you truly need to control the symptoms and to get to the level that you need, unless you need more than one patch, but that's excessive. Most patients prefer not to use these patches after having experimented with them. The method of choice is natural testosterone gel that is applied to the skin. The dose will be individualized based on age, body weight, and blood blood levels. As with other hormones that are natural and bioidentical, natural testosterone is available from compounding pharmacies. I believe they also have now bioidentical testosterone available in the regular pharmacies, but anyways, you always have to check that kind of stuff, right? Testosterone should not be used if one has active prostate cancer. Multiple medical studies have proven that testosterone has not been shown to cause prostate cancer. In fact, low levels of testosterone are associated with more aggressive tumors. However, if one does develop prostate cancer, testosterone supplementation might accelerate the growth levels of the tumor. Therefore, there is a need to monitor PSA, which is a prostate marker, on a regular basis to assure that one does not develop prostate cancer. Prostate cancer is the most common cancer in men and can often be detected by annual PSA test. Remember, testosterone does not cause prostate cancer, but if you already have prostate cancer, it can make it grow faster. Therefore, we want to avoid it in men who has prostate cancer. However, there is potential evidence that if you take testosterone to the normal levels, you're less likely to get prostate cancer. A recent summary article appeared in New England Journal of Medicine, January 2004. I guess it's 20-year recent. The authors concluded, we reviewed decades of research and found no evidence that the testosterone therapy caused prostate cancer. In fact, prostate cancer became more prevalent later in life when testosterone levels decline. So testosterone level goes down, prostate cancer risk go up, right? So if you try to match the curves, bring the testosterone up, there's a potential prostate level will go down, prostate cancer level will go down. The authors found no connection between higher testosterone levels and prostate cancer or any evidence that testosterone treatment provoked cancers. The research found no evidence that testosterone therapy caused prostate enlargement either. More importantly, testosterone was found to significantly protect against heart disease. Testosterone was found to be beneficial and safe hormone. I'll stop here with the reading of the book. I'm trying to make these videos about 20 minutes each. I'll post this, even with the interruption, because again, I'm not editing it. And then we will work on reading the remainder, which will be testosterone for women, DHEA, melatonin, and then a quick summary of all of this brochure about bioidentical hormones. I hope this helps. I'm going to stop the live, and you guys make sure you subscribe and follow and do all that right stuff.